happy to be here. I thought I'm going to talk after the lunch. I thought it's better. People can drink wine. It's perfect for me. It's an honor to participate in this Congress with Julia. Julia, you speak English very well. The translator, you have a very hard work with me. Today, I'm going to do a exception because I want to dedicate this session to everyone that's suffering in Valencia with a catastrophic situation for the Dana. I have a friend that's lost all, clinic, home, car. Thank you so much for people, help people. A disclaimer, it's a small step we take leads to better experiences for us and for our patients. Let's explore, learn, and share our expertise together. You can look at paradoxical effect with the botulinum toxic treatment in the MEXS sector. In the treatment techniques, we are looking how to control this situation. The first part, we are going to talk about the theoretical part and practice part. Today, it's very important. It's my first experience in the international event. I want to show you how precision can be the key to success or to avoiding unexpected disasters. Okay? Precision is very important. Remember this word. Remember, precision is very important. Before going through, it's important to clarify some concepts. Okay? The first one is the toxins are not comparable. Okay? Not comparable. In this chart, you can look little difference between different botulinum toxin. For example, size. In botulinum toxin, we have 150 kilodalton. It's a part active of the neurotoxin. In this study, it's very important because you cannot compare botulinum toxin because you have different manufacture process, potency tests, because industry pharmaceutical has patents. You cannot to change dosage between botulinum toxin, okay, are different. It's very important. You have to know how your neurotoxin work with this, no? Thinking about the unique clinical profile. And thank you so much, Sophie, because you talk about the sustainability. Is only I have this slide talking about this, and it's very important because sustainability promotes social well-being, ensure long-term economic viability, acting in a way that protects and preserves the planet resource. That's very important. Bocotur can be stored at temperature and room temperature 3 years. If you have Bocotur 3 years in a room, you have a big problem. Okay? But no, it's true. It's very important. And the second term is molecular potency. It's very important because it's a very important concept because the active part of the neurotoxin that reaches to the receptor. It depends on the molecular potency. We have the start of the effect and the duration of the effect. In a picture, you can look at beautiful neurotoxin with protein. And MERT worked very hard because we do a pure neurotoxin, eliminate the protein. Only I say this about the immunology. I think that this is a concept for the future, very, very important. The most important for the future is know the immunology. All botulinum toxins have the same action mechanisms. Look at video. We are going to explain this. It's a beautiful video. Imagine lock and key. How work the muscle? When vesicle with inside acetylcholine go to the neuron membrane, you have a key in the membrane of the vesicle. It's a protein, synaptobrevina. Go to the neuron membrane and find the lock inside, open the membrane, acetylcholine go to the receptor and produce the contraction. All botulinum toxin, all in the market are type A. Type A work for break a protein in the membrane of the neurona. It's a SNAP25, okay? When you have synaptobrevina, SNAP25, we have the complejo SNAR complex. If you inject botulinum toxin in the muscle, you have two chains, light chain and heavy chain. Heavy chain is responsible to introduce the neurotoxin in the neurona, and inside the neurona, separate heavy chain, the light chain. And light chain going direct to break the SNAP25. Okay? And break 25. And when vesicle with acetylcholine arrive to the neuromembrane, it's impossible to insert the key in the lock. And it's impossible acetylcholine go out to the receptor in the muscle and not produce the contraction. Other very important concepts is diffusion and dispersion. Diffusion is a characteristic per se of the botulinum toxin. Okay? So diffusion is high concentration. You inject a high concentration to low concentration. But dispersion depends for external factors. For example, when you inject strong, faster, the dispersion is big. I use always the same example. If you have salt and you put salt in on your hand, it's here, perfect. But if you shoot the salt on the floor, the salt is dispersion. Okay? It's very interesting to understand the external factors. And we are going to talk about external factors. The first one is volume. Huh? People say, no, I'm going to inject with little volume, high units. Okay, pues in the last study, low concentration and high volume, greater diffusion and larger effect area. We have in the right of the picture 2 units and 0.1 milliliters. In the left, sorry. In the right, 2 units in 0.2 milliliters. And we have more effect in the right forehead. Same units, okay, more volume. It's a concept to diffusion. Okay? In this study, Doctora Trindade de Almeida, she studied hyperhidrosis in the forehead. You can look at the diffusion with different botulinum toxin. It's very important to understand when you inject a lot of volume, how is the shape of the injection. And you have the shape of wrinkle was oval. If you have a narrow muscle, it's very important to inject low volume. If you inject a lot of volume, you have problem for dispersion, okay? This study is very interesting because on the one hand, you have guide clinical treatment, and on the other hand, you have ultrasound techniques. Ultrasound techniques is 88% inside the muscle. Only with the guide clinical processes, only 23 in the muscle %. Discomfort patients. Who think that it's better use needle 30G? 30G or 34? Invisible needle, 34G or 30G? Who think it's better? Raise your hand, please. Who think it's better? 30G needle. Okay. And who think it's better? 34G. Okay. This study talks about the not significant difference for discomfort patient. But with 34G, you have no problem with a secondary effect, no bruise. Other concept, very important to treat forehead, is the convergence line. Convergence line, the upper the line or down the line. Down the line, lower forehead, up the eyebrow, and the upper, down the galea, upper neurotic. It's very important because if you inject below the line, it's possible problem with the ptosis eyebrow. Okay? Always I inject on the line. In this picture, it's very interesting, this article. It's very schematic. The C-line, lower frontalis, upper frontalis, and the insertion. It's a concept very important. And other concepts important is notch versus foramen. When I inject in the glabella, I block the notch because we have other studies before, or after, that demonstrate that the inject in the medial, in the supraorbital area can be or can produce can produce a ptosis. Notch 1.5 more frequency than foramen. If you have foramen, 80% foramen, so bilateral, foramen, notch. It's very interesting to inject in this area. Corrugador supercili, chain the injection in the glabella. Okay, because corrugador supercili has a dual role, the pressure elevator of the eyebrow. Nabil chain the technique to improve the eyebrow in the medial of the elevation, but you can produce wrinkle in the middle, no? Omega shape wrinkles. We have a war now in the glabella because who changed the treatment techniques with different pattern in the glabella? Okay, listen. Now, Dr. Sebastián Cotofana, October 24, he said that it's an outdated concept because it's indifferent the for or inject in the glabella because you have the same effect, inject, the same point, the same effect. It's indifferent the pattern of the glabellar contraction. Okay? Other interesting article about in October 2024 is what is better, linear treatment or a spot treatment? What do you think? Linear or a spot? A spot. Okay. Pues this article talks about it's better linear in the forehead, in the glabella, and it's better a spot in the periorbital wrinkles. Right? October 2024. And this article about Dr. Sebastián Cotofana about the factor contributing to neuromodulation-induced upper eyelid ptosis, talk about this. It's very interesting because when you inject in supratrochlear region, only 7% result in ptosis. When you inject deep in supraorbital region, you have 42 eyelid ptosis. So you have to inject very superficial in the middle of the corrugator, okay? Block the notch if you have no problem there. Okay. Well, the practice. Let's go to see the bunny lines. Bunny lines, you have horizontal line in the nose, lateral wrinkles. If you want to treat the horizontal line, it's important low units, only 2 units in the process. If you want to try to treat the lateral wrinkles, you use 2 units in the muscle, in the elevador labio común araquanasi, 2 units. We are going to see the mark in the video. I prefer to look the highest screen. Okay. I say a patient, please wrinkle the nose, mark. You can inject directly in the lateral wrinkle, directly in the horizontal line if you want, in the lateral of the nose. Okay. How many units? 2 units. Okay. Only 2 units, no more. It's a very sensitive muscle. If you inject a lot of units in the lateral, you have a problem because you can a problem in a lip. Okay, the injection. Okay, an injection in the middle. Second one, no stiff repression. It's very important, a concept with the muscle, because you have union fibers, orbicular oral muscle, nasal depressor. It's very important to inject up to the septum. Okay? No word the video. No word. It's very important, no problem. It's very important, inject up the septum. Slow, 2 units. If you inject down in the base of the nose, you have a problem because can be affect the mouth. Okay, and you can have problem with speak or drink. Perioral radial wrinkles. Vale? Subdermal injection, 1-2 millimeters in the vermilion border, a little units, 0.5 on 1 unit, 2 injections per quadrant, not in Cupid's bow. Lip flip is very important to treat lip flip when you have a gummy smile. It's necessary to avert the lip. The units are the same, 0.5 and 1 units, and subdermal injection. In this video is for lip flip. inject very superficial. Now you can look, very superficial. I use a 34G invisible needle. Three points. And the result is very, very well. Okay, the depressor angularis, LDAO, is a sensitive muscle. It's very important to inject in an anatomical area. You can see this picture. It's better in the video. Well, it's very important, the relation in the depressor angularis with the depressor labio inferior. Be careful, because if you go inside the wrinkle, you can inject in the depressor labio inferior to be a big problem, or to be a problem. In the video, the injection is superficial, always superficial. The depressor labio inferior is deep, like platysma in the lateral, 2-4 units. In the video, the mark is in the middle of the lip to the chin, in the lateral of the mouth to the mandibula, and in the middle of the eye to the mandibula. Mark a line to the base of the ear. Okay? 1, 3. Yesterday I had a problem with the videos. Videos was also faster, and now it's original video is slow. In this point, you have the mark for the depressor angularis. It's possible to inject there or in the base to the mandibula, 1 centimeter, ¿vale? On the line. So the injection is a big triangle muscle, very sensitive. Only 2 units is sufficient. Okay. In the up, you can inject there, 2 units, or inject down 2 units. I prefer inject in the mandibular area. If you want to see. Okay. Mentalis. 80% mentalis, we have two types. Type 1 is two bodies of mentalis. The morphology is very important. When you inject, the technique is deep, because the range of the muscle is deep, 7 milliliters. Okay? And this dispersion is, when you inject botulinum toxin in this area, is the diffusion 15 millimeters. And when you inject perpendicular, deep injection, 2-4 units, 1 centimeter on mandibular line. Let's go to see the video. You say paciente, to the patient, en plan, please. Okay? And mark. 1, 2. And when you inject, it's very important to inject deep, okay? Always. The size of the length of the needle is 12 millimeters, pues, all. 2-4 units. Masseter. Masseter is very interesting because the hypertrophy in the masseter is in the superficial band. And you have a tendon in the middle. But it's very important to treat deep and superficial. Okay? 2 parts of the muscle, deep and superficial. I use technica with 3 points, use 8 units per point, and result is very, very well. Right? But the treatment in 2 parts is very, very important. Remember the paradoxical effect in the start, when they start the presentation. Deep injection, 3 points, 8, 10 units per point. We are going to mark the point is to find the anterior line of the masseter, the posterior line, and the up with the ear and the mandibular line. And pulp the muscle, collocate point, respect the anterior area, no dispersion. Always inject it slowly, always injecting slowly. But you have fibers of other muscle in this area. 3 points. And the last one. In the fertility leaf, it's very important indicate exam to the patient because the patient, please, so it's important to look the mandibular line. If you have a lot of laxitude, it's very difficult to treat this. I prefer the video. I use 4 points. The first one is the dow, 1-2 centimeters to the gonia. Okay. I inject 2, 3, or 4 units per point. Okay. I don't know if it's the correct video. Well, it's in the final. Okay, no problem. Platysma bands. Platysma band is very important. So the patient collaborate with you. It's inside the band. The injection is 2 or 5 units per point. I use 5 points per band and 2 centimeters to separate the distance per point. In the video, the patient, again, you can look the band, one band, and mark 1, 2 centimeters between points. Okay, it's very important. It's very important the precision. I like to show you a video about precision. Okay, and finally my presentation. Today I think that this is not my day. I'm so sorry, but it's an interesting video about precision.
Right here and picking the club up like he's going to hit right down on it.
And he's picked out a landing spot that is a good 25 feet above the hole. Here it comes. Oh my goodness.
Ya está.